My name is Dr. Justin Griffin. I want to welcome you to another episode of You Can't Handle the Tooth. So I am the real floss boss, and today we're going to be discussing Invisalign. Very, very popular topic in dentistry. I must get several consults a week, more per month on Invisalign. People will email or even text me sometimes about what is Invisalign, how does it work, and is it just as good as braces? So we're hoping to demystify some of these questions that most people have about Invisalign and how effective it is. So let me start by just telling you a little bit about what Invisalign is. In the history of straightening teeth in dentistry, orthodontics with brackets has been the tradition and the convention. And it works very, very effectively. And then, I don't know, 10 or 15 years ago, probably 15, a system called Invisalign came out. And Invisalign is a way that you can straighten teeth without having to use any brackets. And so how it works is it is a tray like this, a clear tray. For any of you who've ever bleached your teeth before, I don't know if you can see if any comments come in, or you might want to log in on your phone just to check. We had some comments last time and questions. So little clear trays, just like a bleach tray, except it's a little bit firmer, okay, and it fits on your teeth, little snap. That's how you know it's nice and firm and snug around your teeth. And the way that this Invisalign works is it is a series of these aligners. So if you're, let's say your teeth are spaced apart and your teeth start like this, the first tray that you wear is made for your teeth like this, a little bit closer. So you snap the tray in and it's tight. And you're like, oh man, that's pretty snug. And you wear it for about 2 weeks, and then the tray isn't as snug anymore. It comes in and out pretty easily. So we end up taking that tray out and putting in tray number 2, which is for your teeth a little bit closer. And you go through a series of these aligners until your teeth are nice and straight. It works for rotations, and it can do just about any mild to moderate crowding for orthodontics. So that is what Invisalign is. It is a clear series of trays that you wear in place of brackets that are virtually invisible, and they straighten your teeth, and the whole point is that no one knows that you're in treatment while you're in treatment. So we made a list. I have Holly helping me today. Say hello, Holly.
Hi.
And she has a list of some of the most popular questions that we get about Invisalign. So what's one on the list?
How long does Invisalign usually take?
Okay, so just like with braces, Invisalign can take, if you have severe crowding or more advanced case, it can take longer. And if your case is, mild, it's not so bad, the crowding or the spacing, then it won't take as long. So it's hard to say exactly how long it will take without looking at teeth individually, looking at people individually. But generally speaking, it's about as long or shorter than braces, usually. So the reason it can be a little bit shorter is because brackets only apply forces from one side of the teeth. And so from the front side, the wires do all the work, torquing and lifting and stuff like that, where braces can push from the back, pull from the front, all at the same time, so you can get movement a little bit quicker with Invisalign. But there is a limit to how fast you move teeth, because then it can be detrimental to the health of the teeth. So for mild, the average case is probably around 10 months average. But a lot of cases are 6 to 8 months, and then for more extreme stuff, it can be 18 months or more. Okay? What's the next question?
How often do I have to wear my trays during the day?
So people are like, gosh, should I wear them all the time? Like the questions we get specifically are, do I have to eat? Do I wear them when I eat? How do I brush? And stuff like that. So we always tell patients, the more often you wear them, the longer you wear them, the faster the treatment will move. So really 22 to 24 hours out of the day, you should be wearing the trays. So you'll take them out when you eat. You'll take them out when you brush and floss. And then I always add this little thing, two little pieces of advice. The first is you can't really have sugary drinks when you have the trays in. If you have a sugar soda or sugar juice or something like that, and any of that gets inside of where the tray is can really be bad on your teeth, because that's time and exposure to sugar that's really a killer for teeth, and can cause tooth decay. So if you're going to wear them and you want to drink something, just make it like water, definitely sugar free. But if it's not water, I probably would take them out, drink your drink, and then brush your teeth before you put your trays back in. The second thing I tell patients is they say, well, I talk all the time, or I'm in sales. And what I would say is, if you have a big interview coming up, if you have a big presentation that you're going to make, take the trays out and do your presentation. It's fine. It won't slow you down. But if you have a problem, let's say wearing trays at night, like sometimes it can stimulate a gag reflex or something like that, or people will take them out at night and they don't even know that they're doing it. If you can't wear them at night, or maybe you have a job, you can't wear them during the day and you're wearing them about half the time, if you cut the time in half, the treatment time doubles. That's just how it works. Direct relationship. Okay? All right. What else?
You stated that you should take them out if you were going to do a job interview or make a speech or anything. Do the trays make me talk funny?
I get that one a lot too. So the answer is absolutely, they do. You put a tray in your mouth, like try to talk with your bleach tray, and it'll give you a little lisp. It's a little bit weird to get used to, but that's the point. The point is you get used to them. And so your mouth, your muscles, your tongue, your lips will all accommodate to these trays that are in your mouth. So when you first put them in, it's going to be a little bit weird, but literally within a couple of days, your S's will be crystal clear, and you'll be able to talk just fine. So the answer, I haven't had anyone that has come back and said, here, take these trays, I can't talk in them. I mean, everybody adapts just fine to them. So,
how much does it cost, and will insurance cover any of the cost?
All right, great question. I would say that Invisalign costs about as much as braces. So if it's a small case, a less expensive case with braces, it's going to be a little less expensive with Invisalign. If it's an advanced case, you're going to be in the trays for 18 months to 2 years. You're going to pay about as much, maybe a little bit more with Invisalign than you do for the braces. So the disadvantage from a cost perspective is Invisalign cost a lot. The trays cost a lot. When a dentist has to buy the hardware for the brackets and the wires for braces, it's a fraction of the cost of Invisalign in most cases. So generally speaking, Invisalign is simply more expensive. The mechanics and all are about the same. So I hope that answered that question.
It did.
Is there any other questions?
Will insurance cover any portion?
Oh, yeah. Thank you. So we get that a lot too, because some people think Invisalign must be cosmetic, so your insurance will not cover it. However, your insurance does not see the difference. There's no code that's special for Invisalign that's different for brackets. It's just comprehensive orthodontic treatment. And so they really don't see the difference, nor do they care. They understand that it could be Invisalign and it could be brackets, but the purpose is the same, and hopefully the result is the same. And so one of the things I have to applaud dental insurance for, which aren't many, but I do applaud them for recognizing Invisalign as a true competitor to braces, because it can provide the very same results as braces. Generally speaking, that is true. This is something good though. This brings me to another question I get asked a lot. Not everyone is a candidate for Invisalign. So just because you need braces doesn't mean you can always just get Invisalign if you want it. Most cases, without getting too technical, most cases can be solved with Invisalign. But there are still some cases that require advanced tooth movements in order to improve a jaw relationship, or maybe you're getting in adolescence, your jaw's still growing, or things like that. There are some instances and conditions that require braces. But for the most part, particularly in adults mostly interested in cosmetic braces, Invisalign will do the trick. But most teenagers also would qualify for Invisalign. Okay? Anything else? That's it? Could you see if any questions came through?
We have no questions.
All right. Well, listen, I want to thank everyone for joining us. again here on You Can't Handle the Tooth. This is the Floss Boss, Dr. J, and signing off. Don't forget, please like our page and continue to submit your great questions. That's what leads to these videos. We will be posting this on Facebook, and it'll also be on our YouTube channel. So you guys have a great week.